Hello, and welcome back to the video series from the Maryland Healthcare Coalition Against Domestic Violence, centered on the intersection of health and intimate partner violence. My name is Lauren Doherty. I am the Training and Outreach Specialist with the Healthcare Coalition and the host for this video series. Today I'm with Roz Berkowitz of GBMC's Safe and Domestic Violence Program and Steering Committee member of the Healthcare Coalition. Roz is going to be talking about how to document intimate partner violence in the medical record today. Roz, maybe to get us started, you can discuss why it's important to document IPV in the first place.
Sure, Lauren. Medical documentation of injury and evidence can be very beneficial for victims of intimate partner violence who decide to access the criminal justice system. Documentation within the confidential medical record can be used immediately for protective order hearings, can be subpoenaed for subsequent criminal proceedings, or can be produced at a later time to demonstrate a history of abuse, even after injuries are healed.
And what are things that healthcare providers should keep in mind when they're documenting in the patient's medical record?
When documenting intimate partner violence, it is important to include any injuries observed, highlighting any defensive injuries. Noting on body maps is also helpful whenever possible. The healthcare professional can take pictures with informed consent and also encourage the patient to take and save their own photos if it feels safe for them to do so. The patient's demeanor and affect is important to include, as well as any details about the abusive partner. For instance, partner's name is Jane Doe and date of birth is January 1st, 1973. Providers can include what the patient says using quotes. So instead of patient's boyfriend slapped her in the face, the healthcare professional should document, patient states, my boyfriend Tommy slapped me in the face. This is also very important because statements made during the course of medical treatment are often admissible in court. And then lastly, it is critical that the correct medical terms are being documented in the medical record, so that if a patient has used the word choke to describe an experience where their partner put their hands around the patient's neck, externally constricting either their breathing or the blood flow to their brain, that medical professionals know the correct terminology to document is strangulation.
Is there anything that healthcare providers should leave out of the medical record?
Healthcare professionals should avoid using judgmental language that sounds like they doubt what was reported to them by the patient. In court, phrases such as patient refuses, patient alleges, and patient claims may carry judgments that we don't intend. So instead, healthcare professionals can use phrases like patient declines, patient reports, and patient states. Another very important piece to make sure to leave out of the medical record is any specifics of a safety plan. It is okay to say something brief like safety plan discussed or patient has a safe place to stay, but it is important to leave out any details that could compromise the victim's safety if discovered in the future.
And then Roz, is there anything else that you'd like to share with healthcare professionals before we wrap up today?
Yes, good documentation is helpful in court, but it can also keep you out of court. Don't ever be afraid to document. If it isn't documented, it didn't happen.
Well, thanks again, Roz, for sharing this crucial information with us on documentation. For those of you who are interested in learning more, stay tuned for more videos being released soon, and please visit our website at www.healthandtv.org.